Start with the patient seated at the edge of the bed. Always have a garment such as a gown or t-shirt on under the orthosis with as few wrinkles as possible. No bare skin should come in contact with the TLSO. This will help to protect the skin as well as keep the orthosis clean. Place the back of the TLSO on the seat low and centered on the trunk with the side panels aligned over the pelvis. Wrap the left side panel with the anterior panel down and around the hip. Once the anterior panel is centered, put a downward pressure on it to keep it low and touching the thighs. Then wrap the right side panel around the hip. Velcro it to the left panel. Tighten the TLSO by pulling the two pull tabs on either side of the orthosis at the same time. You will know it is tight enough when you cannot pull the tabs any tighter. If the TLSO moves on the body, it is too loose. In order to properly support the fracture, the TLSO must be worn tight. If the patient indicates they cannot tolerate the tightness, then loosen the tabs by 1/4 inch. Secure the shoulder straps. They should be snug but not so tight as to cause the orthosis to rise up. It is impossible to get the TLSO sufficiently tight when the patient is sitting. You will need to have the patient stand to tighten fully. If the sternal extension is encroaching on the neck or chin, the orthosis is too high. If the straps are loose, the orthosis is too high. If there is abdominal tissue protruding under the TLSO, the orthosis is too high. Remove the TLSO and don lower. Now the sternal extension is 2 inches below the clavicle. The shoulder straps are snug and the abdominal tissue is contained. If the patient is slouching, the sternal extension will appear to encroach on the neck. Make sure your patient is sitting as straight as they can. For people with kyphosis, they will need to be moved to a chair for proper donning. Get the TLSO on as best you can with them sitting at the edge of the bed, then transfer them to a chair so their pelvis is touching the chair back. Undo the TLSO and ask the patient to lean back into the chair. Then proceed with donning the TLSO. Now the TLSO is able to hold them in a less kyphotic position. Have the patient seated at the edge of the bed. First, loosen the two pull tabs. Hold the tabs firmly and loosen slowly. Sudden loss of support could cause increased pain or further injury to the spine. Velcro the tabs on the side panels where they line up with the side of the trunk for ease of donning in the future. Next, unclip the right shoulder strap. Lastly, unvelcro the right side panel with the logo and leave the left side panel attached to the anterior panel. Attach the Velcro back to the orthosis to prevent it from getting tangled and to preserve the life of the Velcro. If the pull cords are loose, then you need to reset the pulley system. Pull the side panels in opposite directions to stretch the pulley system.